Rosy Winter Productions has a vision of a future filled with confident, empathetic adults who are very well equipped to deal with life's mental and emotional challenges. In past episodes, we offered tools for caregivers to help their children in their lives develop positive mental health habits. We've discussed the benefits of community, remembering that not only does it take a village to raise a child, but also to support the parents, teachers, coaches, and caregivers. As we continue to include you in our vision, we hope that you will enjoy Season 3 of Through a Rosy Window into Wellness. We venture out to speak to some of those key people who are impacting the mental health and well-being of our village, Fort St. John, BC. We began this journey of discovery with the first place a person might look when trying to find health care in Canada. That's with our publicly funded healthcare provider. Fort St. John is part of the Northern Health Authority, which if you do a quick internet search, you'll find the regional offices in Prince George. This health authority cares for more than 300,000 people. This area is divided into 3 regions, the Northern Interior, Northwest, and Northeast. Heading up our area, the Northeast region of Northern Health, is Angela DeSmit. Her 40-year nursing career has offered her experience in many areas, but it was her preference for remote and rural practices and her desire to give back to her community that led her to this position. I was so pleased that Angela took the time from her very busy schedule as Chief Operating Officer of the Northeast to talk to us about Northern Health's role in keeping all of us Northeasterners healthy.
So Northern Health offers a large array of healthcare services within the public system. And that ranges everywhere from community, and that can be home support, that can be community rehab, that can be assisted living support, dietitians, social workers, just a wide range to help support individuals to stay in their homes for as long as they're able to, but also for as long as they want to. And then we also provide services in the hospital setting, so at the Fort St. John Hospital, with a wide range of services from the emergency department to the maternity or birthing center. We have a full operating room, and we do have quite a number of specialists that come to our area to perform surgery, so our community members don't have to travel as a result of that. And we have an inpatient unit and visiting specialists. We provide chemotherapy and a cancer program as well as hemodialysis. So you can see we have quite a comprehensive service delivery along with your diagnostic testing. So from your X-ray department, which is ultrasound and X-ray and CT scans and MRIs, to the lab department, trying to offer more and more locally for individuals. And then the other aspect that we have is long-term care homes. Mental health services is one of the other key components that we have within our spectrum of care. We're all aware of the toxic drug and the drug emergency crisis that we're under right now, and some of the successes that I've seen in Fort St. John in regards to supporting individuals with mental health is recognizing that sometimes it can be mental health and substance use, or it can be mental health on its own and substance, but we have clinicians that can work across that spectrum and help the patient where they're at. We have heavily invested in supporting and collaborating with our community stakeholders about harm reduction kits, keeping our community members safe, and supporting other organizations and coming together to identify the vulnerable population. Going into schools, we have a youth counselor that goes in, trying to build resiliency in our youth and collaborating with some other mental health organizations that provide those services, as well as we're very fortunate to have 2 psychiatrists within our community here in Fort St. John. And so they have a referral process and are able to work with either themselves or within their team for regular consultation as well as initial assessments. So we've got an OAT clinic, which is an opiate antagonist clinic. So when we do have individuals that are trying to get off of some substances, then we provide counseling and we provide support, and we have a psychiatrist either virtually supporting the clinic or in person at the clinic. We're very proud of the programs that we offer. That being said, we do have some significant deficiencies in terms of our services, and a number of those are directly related to our ability to recruit and to retain staff here in the north and particularly in the northeast. There's lots of benefits in terms of coming to the north and having access to additional education funds and additional education in order to draw people to our community and to make sure that we can maintain services. But at the same time, when we're looking at a healthcare provider shortage, both in British Columbia, but also across the nation and worldwide, we do have to be competitive in terms of what does that look like. And a lot of it is how do we showcase the beauty and the benefits of living in our community as compared to maybe limiting to it financial. But what does it mean to actually live in Fort St. John and the services that are available as a result of that? A lot of it is just getting them to our community. And then once they get to our community, we've all heard the stories of I came for a year and I stayed for 7 years. And they see how warm and welcoming the community is, the events that you can do, how it's reasonable for young families, which is a big core of Fort St. John is the young families. Virtual care has been a tremendous addition, and we've improved our technology so that makes it easier for the individual when they're communicating and to use the tools so they can use them right within their own home, or they can come into one of our health centers and we can help them with set up for those appointments and participate. So reducing the amount of out of community and the travel costs and accommodation and those types of things. In my opinion, the things that are unique to our area is the rural and remoteness. And the other thing I really feel that we in rural communities, and it's seen all the time in Fort St. John, is our community partnerships and the strength that we have, because we're all looking to improve services, whether it's health or other social economic, so could be housing, could be access to food, those types of things that support our community. We all have an invested interest in that, and we all work together to identify opportunities to collaborate, to continue to bring services to our community. So from my professional viewpoint, what I see as recommendations is we need to talk to our children earlier. We need to talk to them. There is a lot of distress out there with our children in terms of what's happening in the world. Talking to our kids and helping them to be resilient in terms of what are the important things within their world and their spectrum of control, and where do they go for help. Community collaboration is just so powerful, And even more so, I've experienced that when we have been trying to work to figure out solutions for individuals that do not have a home or have other vulnerabilities like substance use, and how we can partner and strengthen the work. And Northern Health works very closely with the Salvation Army and the Women's Resource Center, and we collectively work on solutions together. So what we do well and very fortunate is that we have a lot of visionaries in our community about what are coming together, talking about the gaps and how do we tackle those gaps, whether it's looking for some temporary funding until we can get permanent funding to build and then sustain programs, and what can we all contribute to those programs, whether it's in terms of donations, it's personnel, it's supplies, it's operating budgets, those types of things, and how do we work together and make sure that we have a community that's vibrant for those that are living here and for those that want to come here, because we need both. We need to make sure that we take care of our own and the people that live in our community, but also to embrace those that are coming to the community, because we need them for sustaining our services and taking care of other or providing other services within our community.
After a visit to Northern Health's Northeast corporate office, we paid a visit to the health unit and the primary care clinic to speak to Sherry Saka. She's the community service manager. Sherry and her husband, who are both professionals in the healthcare field, moved to Fort St. John in the early 2000s. Sherry gave us a wonderful tour of a couple of the facilities here and a terrific overview of some of the services that are offered here in Fort St. John.
This role as community service manager now oversees public health, mental health, home care programs, home support programs in this community and around the surrounding areas. The sites that I oversee are the Fort St. John Health Unit and the Fort St. John Medical Clinic. First, actually, I'll talk about the Fort St. John Health Unit and what's located here now. The Fort St. John Health Unit now oversees the home support programs, the independent living programs, which support our seniors and individuals in the community that need assistance. We have a short-term home support program, which is a rapid access program for people that need to be seen, perhaps coming out of the hospital for a couple days. We have audiology here. We have dental programs, environmental health programs, licensing. And then we also now have a lot of regional programs that have office space in this site. So it could be from Prince George, they're a regional program, but they outsee all of Northeast area perhaps. Then in the Fort St. John Medical Clinic, we now have all of our, what I'm going to call is primary care services. So primary care is really looking at the individual and just involvement of so many different individuals, persons centered in the middle, and all these services are garnered outside. So we have public health programs, we have mental health and substance use programs, we have home care programs. There are long-term care service programs that we oversee. And then we work now with the primary care homes, aka the physicians' offices, to support kind of that all-around care for these people. When I say these people, all of our clients and the people that the physicians see, trying to support them the best we can with the services that we have in place. And it can be challenging. And during these times right now, staffing can be a challenge, but we do our best. Basically, our programs will see anyone from, I call it from birth to death. So we will see new moms, new babes. We are involved with the prenatal clinic at the Fort St. John Hospital. We see anybody within any program I will say, except youth mental health, that is a specialized area that we don't see. We work with youth mental health to transition to adult mental health, absolutely. So that piece we do. But we work with specialized youth or children through the nursing support services. We work with Community Living BC with our HSCL nurse, which is our Healthy Services Community Living nurse. So she supports that area. We also have mental health and substance use. As I mentioned, we see them adults, so 18 plus is our program. We also do the seniors. So we have an assisted living facility called Heritage Manor 2, which we have 24 beds, 24 rooms, not beds, I'll say. We also have social workers. We have occupational therapists. We have rehab assistants, social work assistants, dietitian, uh, rehab, like physio, if it's posted, we just don't have it right now, but those are all other services that fall under our portfolio. Again, limiting is those sometimes the vacancies, but we do our best. And I would say too that so social work, for an example, we originally had social workers being posted. Social workers are hard to recruit too. So, looking at then what can support social work. So a social work assistant, we were having those through Northern Lights College being educated, but yet not enough roles for them. So that was something then we looked at, how can they support our limited resource pool of social workers. So we've now introduced those into our programs, which have been a great resource for the social workers. So trying to figure out, not work harder, but work better and work together. Who can support us in this ever-changing world of healthcare? And so that's kind of some of the other things that we do too. Space, there is a room that we can utilize for people, nonprofit groups, individuals that have any kind of support group, we can offer that to people. And there is no charge for that. It is just an agreement that we put in place. Then we just go through the rules of the building, but it is something that is definitely can be utilized here. We're seeing more of that probably in the last 2-3 years. People have reached out again. And again, I think it's post-COVID that we're seeing that again. We had people, groups coming before, but now we're starting to see it again with more face-to-face visits and things that are going on again. I think one area, and I think this is provincial wide, to be honest, is housing in Fort St. John, for seniors, for a multitude of individuals, I think is something that we really need. Salvation Army too is another group that's expanding, and that's great for this community. Putting supports in place for individuals and housing needs, and same with Women's Resource Center is another place, right? Trying to support this community. Community Living BC is another one. And just reaching out now, I think, is something that we need to do post-pandemic for sure. I think pandemic, as much as we don't want to talk about it still, has caused a lot of things probably just to be more out in the open as to maybe some what can I say, areas maybe that we were not doing well with. And then, mental health and substance use for sure is one of those areas. I know that it's a big concern in this community, mental health for sure in every community. But I think post-pandemic, and I think people were isolated for so long that now we're starting to see, the effects of that, and especially within the mental health and substance use. Volunteerism, I will say, is a big one, and that's not only for Northern Health, but I look at it from the seniors groups, all the groups that I attend. When we go to the Save Our Northern Seniors group, for example, there's multiple different organizations out in this community that are trying to support but that support is limited. Volunteers in the community is what drives wellness of the community as well, and wellness of the people that are volunteering. It can be as big as you want it to be or as little as you want to volunteer. But I think that that is an important place that we in this community need more support. And it's not only Northern Health. That is, I would say, Salvation Army, the Women's Resource, just being out there um, to support individuals, and that's one area for sure that I think we need some more support.
We can certainly see that there are a vast array of factors that affect the mental health and well-being of the citizens of our city. I think we can all agree that we can be part of creating positivity in the communities that we live in, perhaps on a large scale, like in a large organization, or maybe on a small personal scale, with gestures contributing to the well-being of those around us. Shoveling someone's sidewalk, doing a wellness check on a neighbor, or simply offering a friendly smile and holding a door. Both of our guests in this episode discussed how important it is to collaborate with other community members. In our next episode, we will get to meet and chat with some of those collaborators.